My name is Mary Beth Miller. I'm the nurse manager for the Neonatal Intensive Care Unit here at St. John's Children's Hospital. St. John's has long supported the care of premature babies. Our unit is nearly 75 years old, so the commitment has been there for a long, long time to take care of these babies. Not only premature babies, but all babies who need special care their first few days or weeks or months of life.
My name is Bo Batten. I'm the Director of Newborn Services here at St. John's Children's Hospital, and I'm the Chief of Neonatology for Southern Illinois University. 1 out of every 9 babies across the country and here in Springfield, as well as Central Illinois, is born premature. Oftentimes, premature babies require a higher level of care, and the neonatal ICU at St. John's Children's Hospital is able to provide that care.
In the early 1960s, Patrick Kennedy was born to President Kennedy and his wife. And he was born at 34 weeks gestation, so he had immature lungs. And he was premature. And despite the best medical care in the world, he passed away. He did not make it. Today, a baby born at 34 weeks gestation has a greater than 99% chance of surviving.
When neonatal intensive care units first became prevalent 3 or 4 decades ago, the focus was on helping small babies to survive. As medical technology and therapies have advanced, in many cases, survival is now an expectation. Consider for a moment the normal environment for a fetus 25 weeks after conception. It's an intrauterine environment, quiet, dark, solitary, and submerged in water. Now imagine the postnatal environment that infant is exposed to when he or she is born nearly 4 months premature. Loud noises, new smells, bright lights, and frequent painful interventions. A world of auditory, visual, and tactile stimulation. With millions of neurons firing and wiring, brain growth occurs in the newborn infant at a pace unmatched during any other time in life. And there is no other place in the hospital in which the environment where care is delivered has such a crucial impact on the patient's development. Our goal with the development of a new state-of-the-art neonatal intensive care unit is to create a world-class facility which provides family-centered, developmentally supportive care. An environment that not only helps a preterm infant to survive, but also maximizes that infant's developmental potential and prepares parents to help their baby thrive after going home from the hospital.
We do have space constraints because we just don't have the space to put the furniture, if you will, to accommodate the parents in a comfortable way. We're moving toward a single patient room concept where parents can have that privacy to hold their infants, to do the one-on-one care, to mom to nurse the baby. The most rewarding part of my job is such a hard thing to pin down. I think most of us would say seeing that tiny baby struggling to live in their very first moments of life and then witnessing that going home with their parents. There's just nothing like that. I just can't even describe how awesome that is, and just hugs all around and congratulations and just such a big day in our unit.
I think there are 2 things that are the most rewarding part of my job. The first is when we see babies come back 2 or 3 years of age, thriving, doing well, and to think back about where that child came from. The other thing is the people that I get to do this with. My physician and nursing colleagues are some of the best people I know.
Just seeing the size of babies that we can save and what we can do for them, not only with the technology, but just even with the family-centered care. We've just come such a long, long way, and that's really rewarding to see, having chosen this career path, to see something so remarkable evolve.